This study is titled LSD-Assisted Psychotherapy for Anxiety Associated with a Life-Threatening Disease. This recently published study shows the safety and efficacy of LSD-assisted psychotherapy in patients with anxiety associated with life-threatening diseases. The use of mind-altering drugs such as LSD has been known for thousands of years with religious and healing purposes. Psychological treatment of people experiencing the challenge of suffering from a life-threatening disease and those who are in the process of dying is still mostly inadequate. These patients using psychological treatment of today typically suffer from adverse symptoms such as isolation, anxiety, and depression. There is obviously a great need for more effective treatments. This approach includes carefully supervised use of LSD in conjunction with psychotherapy. Long-term effects on anxiety as well as subjective experiences and lasting psychological changes are all evaluated in this study. The intense psychological effects of LSD include increased sensory perception with illusionary changes of perceived objects and enhanced mental imagery. Thoughts are accelerated with a broadened scope to include new associations and altered meanings of relationships and objects. Without any clouding of consciousness, the dreamlike altered state is experienced with full awareness of the self and good memory of the experience. Ego identification and ego boundaries are weakened. The effects of LSD typically last from 6 to 9 hours.
The study was a double-blind, active, placebo-controlled randomized trial. The participants initially underwent a 3-month treatment phase of 6 to 8 psychotherapy sessions, with 2 LSD therapies embedded at 4 to 6 week intervals. 8 of the participants received 200 micrograms of LSD, which were chosen so as to not overwhelm the patients while they were still high enough to allow for peak psychedelic experiences. 4 received 20 micrograms of LSD as an active control. Drug sessions were therapist-guided and lasted 8 to 10 hours with music, short talks, and other interventions. 10 participants enrolled in the long-term follow-up. There were many psychometric measures taken at baseline, but for the purpose of this study, we will only focus on one. At baseline, and 1 week after the experimental session, as well as at the 2-month and 12-month follow-ups, the participants responded to the Spielberger State and Trait Anxiety Inventory, Form X. Next, the participants partook in detailed, qualitative, semi-structured interviews to understand the client-centered perspective. This took place while the participants were at home and over the phone. The focus was on subjective experiences, changes in daily life, quality of life, anxiety, attitudes, and values as related to the LSD-assisted psychotherapy.
Participants did not report lasting adverse reactions. Some experienced initial difficulty in giving up self-control, and some found it was difficult to experience more intense emotions, but all patients reported much of this tension was dissolved afterwards. The benefits measured by the STAI were sustained over a 12-month period. The qualitative content analysis revealed that participants reported insightful, cathartic, and interpersonal experiences. 77.8% reported a reduction in anxiety, and 66.7% reported a rise in the quality of life. Suggested major psychological working mechanisms include facilitated access to emotions and confrontation of previously unknown anxieties. These LSD experiences led to a restructuring of the participants' trust, situational understanding, habits, and worldview.
Moderate yet stable psychological improvement observed in all patients over a 12-month period. There's also an improvement in psychological symptoms along with positive psychological change in subject, such as increased relaxation, mental strength, self-control, and self-assuredness. There is still limited knowledge on the neurobiological effects of LSD-like hallucinogens used in psychotherapy. A few subjects experienced some difficulty with initial effects of LSD. There was also a small number of participants, only 10, and there was no control group for follow-up. For future directions, we can determine long-term results at a sustained neurobiological level, and we can also further examine possible neurobiological mechanisms in action.